To hear now the Social Protection, Community and Human Development Cluster led by Minister of Health, Dr. Joe Phaahla, accompanied by Ministers of Basic Education, Angie, Motshekga, and Social Development Minister Lindiwe Zulu, are currently briefing the media to address the matters related to the national state of disaster on floods. Let's go to that briefing right now.
Community structures to provide food and also working with development centers. And also on a daily basis, this support has been provided. And specific focus has also been on children who have been displaced from their homes, and also some of them unable also to attend schools, and with families which have lost everything. So the development of social developments and also SASA and also other social professional services comprising of social workers, auxiliary social workers, community development practitioners were all at the center of assisting all the affected communities, the individuals and also households, providing all the needed services. A comprehensive assessment of each community, each household and individuals have been conducted, and all affected people have been provided, amongst others, with counseling services, debriefing, as I've mentioned, also food, other basic requirements such as mattresses and blankets. And also where families have been put asunder by this, they have also come in to make sure that they can be reintegrated. And also a very important service, unfortunately, in this situation, is support for families in terms of arranging funerals. So social development all together with the province and municipalities have been working hard to do that and also provide counseling. So there has been an attempt really to reach everybody. There might still be people who for one reason or another, maybe because of lack of, roads. We're not saying that 100% everybody, we can't claim so, because now and then you still find people who come forward who, for one reason or another, have been missed. But the attempt, working with all the stakeholders, have been to reach everybody. Also, the teams have been working hard to provide psychosocial support to families and individuals at community level, in all these places where people are housed in halls and other centers. Social workers have already reached over 15,000, almost 16,000 individuals in this regard to provide the support services. From the SASA side, also the SRD fund has also become very handy. More than 3,000 individuals have already benefited from this, with almost 5 million rand already distributed. Uniforms have been purchased for learners who lost everything, to the value of just over 370,000 rand. So the DSD and national national DSD and also the provincial side have been engaging also with corporates, working together and other stakeholders to provide support in the form of various humanitarian reliefs. And mobilizing these various stakeholders also to contribute, so that there is a coordinated effort. And some of these goods have been stored in the Maritzburg area, but also at the Dube port in eThekwini. Many organizations, churches, community members have also answered the call and provided support in a variety of forms, including some of them contributing in the form of finance, others in goods such as food and clothing, sanitary towels, and a few other relief measures. Government we've also received pledges and material assistance from embassies of various countries, and we really appreciate this. Our Minister Zulu and also the Deputy Minister have all, as I've said, been on the ground in the province, visiting the eThekwini, Ilembe, and the various other districts which have been affected. As we speak, Deputy Minister has been to areas such as KwaNgobo and Emakaqini, and Emakaqini. I hope I'm calling it correctly. So we have made sure that we not only rely on the reports which we get from our people on the ground, the officials and the professionals on the ground, but also making sure that we are there to witness and we meet on the ground. In the Eastern Cape as well, a total of just over 2,000 people have been affected in the OR Tambo and Alfred Nzo districts. Assistance in the form of social relief of distress is also being provided in the Eastern Cape. In the Western Cape, SASSA continues to provide support to the more than 765 people affected by the fire at Kwalanga Township, as well as also 30 people who are affected in the Guguleto area. So in these areas as well, support has been provided in the form of hot meals, blankets, mattresses, and also dignity packs. I will then proceed to the next department, which has also been on the ground providing assistance, very closely related to the work which DSD is providing, is the Department of Women, Youth and Persons with Disability. Women, youth and persons with disability are particularly vulnerable when this kind of disasters happen. They are very highly impacted by this in their homes and where they stay, and even including where they make their income, businesses or in their work. So the Department of Women, Youth and Persons with Disability is facilitating the rollout of Women's Economic Assembly to all the provinces, and KZN is a priority. So Wekona Executive is developing a program of action in an effort to enlist assistance to women and children who are the victims of these floods. A donation of shipping containers has been secured from Transnet, and we'll work with the Solidarity Fund and the National Empowerment Fund on how best to allocate these shelters so that people who need immediate assistance with shelter can be able to use some of these containers. Also, there's been attention to issues of assistance with those who are out of school, with the loss of infrastructure, the children, in terms of those who also have now been cut off from water supply, and also the supply of sanitation, basics for good sanitation and just good hygiene. This situation is also the situation of people who have already disadvantaged has been made worse in terms of access to food. So the poorest of the poor are the most affected in terms of lack of access to food, water, and sanitation. And this department also working with other departments of national, province, and local have also been attending to these matters. So the department is also obviously working hand in hand with DST, the issue of sanitary pads and other basic equipments. Plans are in advance in terms of assuring that these donations reach people who are displaced and especially deserving women and girls. So as I've said, working closely with the DST. A distribution mechanism is being put in place to ensure that those who are in dire need can access this assistance. The department is also working with the Office of the Premier, monitoring accessibility of services for the women and the children and the people with disability, because even when there is such intervention, it's very easy that some of the most vulnerable people can be left behind. Also, what is important is to monitor for this department is to monitor that in the shelters that the women and the young girls are safe, so that there is no additional challenges of abuse and gender-based violence and femicide in the shelters themselves. Also, we know that the recreational facilities have not been spared, so this has really taken away a lot of very essential recreational activities. And here the department also notes with sadness the fact that a young artist by the name of Nathi Majola, who is a music producer from Pinetown, lost his father and brother and tried to take his mother, who was seriously injured, to hospital, but unfortunately ultimately also lost the mother. So this is just an indication of the kind of tragedy we're dealing with, and so working with people like Nathi Majola to try and make sure that they can be assisted to mobilize support for immediate relief, but also to make sure that a young person like him can be able to get back to work, as a music producer. It's going to take some time of counseling, material assistance to get, people like him to really get back on their feet. From the health sector has lost the facilities which have been affected. 66 facilities have been affected, resulting in mainly roof leaks and flooding into the clinics and the hospitals. The breakdown of affected facilities as the different districts in terms of a breakdown is that in eThekwini there are 24 facilities. In the Ugu district, 15 facilities from hospitals, health centers and clinics. Umgunguntlovu, 9 facilities. In the Ilembe district, there are 8 facilities, and in the King Kechwayo area, 2 facilities. Fortunately, there's been minimum of disruption in terms of the core services for health. The cost of the repairs of the damaged facilities is estimated to be just a little under 190 million, but there is still further work being done to see whether this may need more, or maybe some of it can be done at the lesser fund. But at the average, this is what has been arrived at between our national health infrastructure team and the provincial health infrastructure team. Healthcare services continue to be ordered to displaced communities that are currently in the shelter halls. This includes making sure that those who are on chronic medication are visited, and they can be able to receive their chronic medication wherever they are, recreating their records to make sure that they don't have a relapse of the conditions under which, some of which may have been under good control. Water has been partially restored to some of the facilities, because while the actual facilities, few of them were seriously damaged, many of them could not function optimally because of lack of water. Because when the water pipes are broken in the local areas, it affects also health facilities. But the water has been restored in some partially in some of the facilities, but others are still depending on delivery of water tankers. As far as where there has been restoration in the Gamalake, in the south coast, the community health center there, the water is restored. St. Andrews, CHC as well, Ekuhlengeni CHC, and also in the JG Crooks hospital, also in the south coast, so there's been a partial restoration. Water is still being supplied to the following facilities through water tankers into their reservoirs: Wentworth Hospital in Durban, Prince Mshini Hospital in Mlazi, and Osindisweni in the north of towards the Tongat area. Those hospitals are still being supplied by tankers. We still have a challenge in as far as making sure that Prince Mshini Hospital, which is a very busy hospital, can really be put to full capacity, because of the fact that a hospital which on a daily basis in an outpatient sees more than 1,000 patients, you need really well functioning water system. But they are trying their best in as far as making sure that this is fully restored. But of course, this is not just a health matter. So as the water supply to the Umlazi area is fully restored, those pipes will be able to restore water to the hospitals. There were also issues which have been sufficiently dealt with, where there were delays to the bereaved families in terms of conclusion of postmortems, because when a situation like this happens, when we talk about more than 400 people dying from this disaster, it means all those deaths are what is called unnatural deaths. So for every unnatural death, there has to be a post-mortem, because that's what the law requires. Our teams there have been able to bring in additional capacity, and they have been able to make sure that almost all the postmortems have been concluded, and so that when if there are any delays in terms of families getting closure, in terms of being able to put to rest their loved ones, it should not be because the postmortems have not been concluded. So we are very happy that that part has been addressed. From what I've been informed, very few, if any, are still left. There are no major problems in terms of families being able to bury their loved ones. Lastly, in terms of the basic education, Minister Motshekga, together with the MEC for Education, the MEC Kwasi Mshengu, have visited the affected schools. The basic education sector has been quite severely affected, with more than 630 schools affected, 101 inaccessible, and 124 have seen extensive damages. We can confirm that 64 learners, unfortunately, have been reported to have passed away as a result of this disaster, while 5 are still missing. 1 educator and 1 food handler have also been reported to have passed away as a result. Schooling is proceeding elsewhere in the province, but in the affected areas, attendance is uneven. Attendance is improving as the situation improves, and there is support to make sure that there is a gradual improvement in the attendance of learners in those schools which have been badly affected, as the teachers are returning to school. The sector is also monitoring on how youth and youth with disabilities are also affected and how they can be able to return. Now, as we conclude in terms of the flood-related briefing, we want to say that we're very grateful with the support and collaboration with all sectors of society, non-governmental organizations, private sector, all the assistance which have been made available. And, it's really brought the best out of South Africans to make sure that we can pull our resources together and make sure that we can reduce the level of stress for those who have lost everything, including losing loved ones. At this stage, Program Director, I'm sure we have agreed that because there is an important matter which Department of Social Development wants to elaborate in terms of some urgent matter relating to the social relief for distress, that they will be given a chance to say a few words just to alert the people out there in terms of some pressing matters relating to the SRD, which people need to be aware, and so that they can respond accordingly. Thank you.
Thank you very much, Minister. And thank you also to all of the South Africans who are listening to this, and to my colleagues in the room, including the CEO of SASSA. I'm Brenda Sibeko, and I'm standing in for the Department of Social Development acting DG, who is not available at the moment. But I'm also responsible for social security policy. So I thought it's important, because there has been such an expectation for the grant to be implemented from the 1st of April of 2022, based on the President's announcement, that we should come and explain what is going on, because we have opened the application portals. One of the challenges that we have had, which is obviously because of the timing of the announcement, is that we normally take 6 months to do regulations. But once the President made the announcement of the lifting of the state of disaster, that meant that this grant could not be implemented under the previous Disaster Management Act. So we had to create new regulations in line with the social assistance legislation. And so that took longer than we'd have wanted, but we are happy, and we want to appreciate all of the people who were able to, during our consultation process and during the public comments period, give us some input on the draft that we published. So now that we have finished the regulations, we have now opened the application portal. I'm pleased to say that it was opened on the 23rd of April at midnight. So people are encouraged to apply. So far, we have received applications of nearly 7 million applicants. And we really, really want to encourage people, because in terms of even the current iteration, similar to the previous one, people who apply in April for the grant will be able, if they qualify and meet all of the criteria, also be able to access, be paid for the period that they applied. So it's really important that for April, those who have not applied and actually need the grant and will meet the criteria, that they use the next 3 days to please apply for the grant. We are encouraging that. Our systems have not, we've improved our systems, so we are able to deal with another 5 million or so applications in the next 3 days. So I wish to encourage people to apply. Those who wish to apply can please use the SASSA website, as you already know it, https srd.sassa.gov.za. I'm sure that this is a familiar site that people have already been using, but we are asking, please, even for people who had gotten the grant before and were receiving it, because we now have a new legislative regime, we now have a new regulatory regime. We require people to apply again so that we can apply the criteria in terms of the new legislation. We encourage you to please reply, and do not be confused with the questions. Some of the questions that are there are not essential questions that you need to ask to answer. So there are questions that we ask that have a cross on them that must be answered. The other ones, such as, for example, your parents' ID and those sorts of things, we are asking those questions because we want to also gather information and develop a better grasp of our South African citizens and some of their needs, so that we don't only deal with people as an individual. It's important to do that for the grant, but over time, as we improve our social security and our social protection system, we need to be getting a better grasp of the population of the country. So we are hoping that you will still provide that information. If you are not able to provide it, please go ahead. Already 7 million people has been able to apply. Not all of them have provided that information. If you are able to provide it, we would appreciate it. In terms of how we are going to be dealing with it this time around, please remember, as the previous iteration worked, that every single month we will be doing the assessment. But we do not require you to apply every month. You will apply in the first month. Now in April, we hope the majority of people will apply now in April. And then we will be testing the criteria that we normally have. And we will be testing it every month. We also wish to request for this time around, because the grant is really meant to be a short-term intervention for only the year. But ordinarily, social relief of distress gets offered on a short-term basis to deal with the immediate crisis that households are facing or individuals are facing. So we would really request that for those people who have the grant, please, after every 3 months, just go back into the website, answer a few questions for us, so that we can keep track and you can confirm to us that you still require the grant. You will not have to do a full reapplication like when you first apply. You just need to answer a few questions on the website after every 3 months, so that we can get a sense that you still need the grant. Because you remember the data that we use, there's sometimes a time lag between when your situation has changed and when the databases have changed. So it's important for us to just keep that relationship going, and we ask that please bear with us. We require that information every 3 months so that we can engage with you. So the other thing that I thought it's important to let you know is that, of course, we have changed the means test. I know that there's been a lot of unhappiness about this. Originally, we had introduced a zero means test. We never actually implemented that zero means test. It's important to clarify that. And then later on, we then said the means test will be at 595, which was the food poverty line. Even that one, we did not implement on every single applicant. We only used it for the people for whom we had to, who submitted appeals, who had been rejected because of being on the other databases. This time around, we are going to be testing every single person. We will be using the banks to be able to check on incomes of everyone, and we have reduced the means test now to 350 rand. I know that even that has made many people very unhappy. We wish to explain that we are dealing with a challenge of so much resource versus needs that are unlimited. So from our data, it seems like people who are earning an income who have income up to the food poverty line would be around 18 million people. The allocation that we have is only for 10.5 million people. So we are looking at ways of making sure that we really prioritize the most needy. I know that it's not satisfactory that we are saying that we are giving the poor, we are separating the poor from the poorest. It's a question of what the allocation is that we have, and so we're trying to manage within that. But also we will be observing as we go along what is the application rate, how many people are actually getting the grant, so that if we need to make adjustments, we will look at making those adjustments. I think this is very important to inform people of. And then with regards to appeals, I know that people have been waiting for appeals from last year. We had struggled a little bit with some of the processes, because remember, in this country there's legislation like POPI, which requires that there's certain information that remains private to the person unless they give permission for that information to be given. And the banks that also would be the ones who provide us information around the income are also bound by other legislation. So we needed to ensure that those legislative things can be met, the legislative requirements can be met, and also that the necessary approvals that need to be given from Treasury side are given for this system to be able to be implemented. We are very close. We think that we will very soon be able to finalize all of the contracts with the banks, and then we'll begin to be able to do the means testing. So we ask for just your patience, but please apply in the meantime, because we will be able to deal with the SRG, the previous ones, the appeals that have been that have been received, and also the new ones that should arise. The appeals in the new system is going to also be electronic, as we've been doing electronic appeals in the previous iteration. The only difference is that they will come directly to the appeals tribunal and not necessarily to SASSA. But in the SASSA system, you'll be able to see when you want to make the appeal where that needs to happen. So we have tried to not change too many things so that it's easier for people to continue with their applications and implement and be able to access the grant. With regards to those who need to ask questions and are uncertain about anything, we would invite them to please call SASSA. The SASSA call center number is operational, and they'll be able to deal with all of the questions. Their number is 0800 60 10 11. 0800 60 10 11. The most important thing we want to say is we want to thank our citizens and the beneficiaries who have been patient with us. We are doing our absolute best to make sure that we do meet your needs, and we request, please, those people who do not need the money to not apply. It just adds to the workload, but it also means that then we'll be dealing with more appeals. We want to really plead, if you don't need the grant, please do not apply, so that we can give it to the most needy, given that there is a budget limitation. However, we also want to say to South Africans, the department is really committed to between ourselves and SASSA to ensure that everyone who needs the grant is able to access it. Our systems are up and ready, so we will be taking we have already taken applications. Please apply. There's only 3 days left for those who want to get their grant with respect to April. If you apply in May, you will get your grant if you qualify only from May onwards. So use these 3 days, the other people who have not applied, to please apply. The systems are available 24 hours a day, so go ahead and please apply on the website number address that I have given, which I will repeat: https // social relief of distress, which is srd.sassa.gov.za. Thank you very much.
Thank you very much. Let me start by apologizing. I think we were alerted that some of the people who are following this media briefing were missing the sign language visuals. It has since been corrected. We apologize for that. At this point, we will entertain some questions. Anyone? A view?
Thank you. Aviwe Mtila from ENCA. I just want to start with basic education, which has severely been affected. We visited some of the 124 schools that have been severely affected, and we saw the damage where the flooding went up to the roof, damaging the infrastructure. Basically, the teachers were telling us that almost everything has been destroyed there, from the textbooks, the computers, admin, the desks, and they said it could take months just to get schooling going again. Have you quantified how much it will cost to repair just those 124 schools, and if the school curriculum will be compromised? Never mind that there are another 101 schools that are inaccessible. Is it the reality is that the schooling curriculum will be finished within this year? And then just moving on to health, there were 66 facilities that were affected, mentioned by the minister. Are there any closed? Can you maybe give us an indication if there are any of them that have been closed? And if so, how soon could that be remedied? And then how sustainable will the people be living in the shelters be living there for? Are there any long-term solutions to get them back to some sort of normalcy? And I know this might not be for the social cluster, looking at the water woes, because I understand, in speaking to the deputy mayor, he mentioned that around 80% of the pipelines have been damaged and it could take months to repair. And I guess that has a direct implication on the social cluster and schools, hospitals and everything. Are there any indications on how extensive the damage is, how much it will cost to repair water and sanitation, for example, and how soon that can be remedied? And then I noted that the relief measures are pointed towards KwaZulu-Natal, the Eastern Cape, and I understand the Western Cape victims of the fire. I was just wondering about the Northwest, where, for example, I understand in the Ngaka Modiri Mulema municipality, there are around 6 villages there that have been impacted severely by floods. We visited some of them in Dielpan alone. There were more than 300 families that have been displaced, given that some of those houses are still flooded this very moment. I was just wondering if there's any relief that will be going towards Northwest and that particular district. Thank you.
Thank you. Is there, can we take online? Who's taking the online one? Okay. Just switch off our view. Yeah. Okay. Takala.
Okay, thank you, DG. We have questions that are coming from Christian Duplessis. It's 2 questions which are all directed to basic education. And the first one is, will the minister elaborate, or will the DBE elaborate on what specific circumstances led to the high death toll amongst learners, and what is the department doing about the situation? And also the questions that is more close to what our viewer asked about the plan to reopen the schools that have been affected. And the last 2 questions are from Carol Patton from News 24, and the 2 questions are directed to social development. And the first one is, government has asked social partners to negotiate a social compact, and one of the important aspects of that is an income grant for the poor. And the question is, did you consult with other parts of government when you have decided to lower the income threshold? And the last one, still from Carol Patton, is, was there any public consultation on the regulations for the SRD grant, or it is not necessary? Thanks.
Thank you. I think I'll hand over to the minister to deploy basic education. Seems to have the most.
Thank you so much, Minister. Thank you, Chair. As for basic education, The affected schools were 630. Not all of them were damaged. Among the 630, some had been cut off as a result of the floods, but the schools themselves were still in a good condition. So we have visited all the schools and categorized them into 3. There are 41 schools which are going to be fixed by schools themselves through the norms and standards allocation. And there are 263 schools, that's category 2, which are going to be fixed by the district offices themselves through the equitable share. And there are 300 schools which are going to be fixed using implementing agents. That's category 3, which means these are schools which have suffered excessive damage, which require professionals. The 444 million, which we have since been reporting on, is based on the assessment which was done after visiting all the schools and receiving reports from district officials and officials going out to assess the damage, and that being the figure that is required to fix those schools. The number of schools that are not accessible has come down from 101 to 52. By this afternoon, the number would have gone down even further, because the Department of Transport and other agents of government are working with us to prioritize those areas where there are schools so that learners are able to go back to school together with their teachers. In terms of the other questions, why more children have died in the floods, well, it's a difficult question to answer, but we know that generally in the country we have more young people, we have more children than adults, and we have more than one in one place. So we can only account for those that were in the system, but we know that the number is much higher because we have 5 in our records who are still missing. Others were not in the basic education system itself, they were in ECD centers. And as the search and as the recovery effort is continuing, we are expecting that the number will be much higher. How are we assisting schools with curriculum? Well, the attendance rate has actually increased. It's above 90% now, and that is assisting because we are able to account for the time that we have lost up until where we are now. The province of KwaZulu-Natal has put together a comprehensive recovery plan which is currently being applied in all the affected areas, and we are confident that they will be able to recover. So that's where we are. But just to add, we also have 633 learners who are in community centers that we are taking care of. Those that have lost their homes and lost their belongings, we have since provided them with clothing, with books, and other basic necessities that they need for them to be able to continue with their lives. And we also have about 455 that are also being given books. Those are the learners that had lost their books in the floods. Thank you so much.
Thank you very much for the questions from Carol Payton. With regards to the consultations, yes, of course, the policy question of income support, more reliable and long-term policy income support for the poor, is a very important policy project of the Department of Social Development, but we don't work on this alone. It's not only a DSD project, it's a project of government as a whole. So there's a whole lot of consultation that happens within government around how to address that question. And also beyond the department and beyond government, we've also been consulting with other stakeholders. On the regulations, we definitely consulted. We published the regulations, I think in February 23rd or thereabout. We published the regulations. Admittedly, we gave a shorter time for responses than we normally would, but that was because of the agency for us to be able to implement. We did publish the regulations. We received many more responses than we were actually expecting given the timeline that we had. I can't read from there, that's fine. On the 22nd of February, thank you. So yes, we consulted quite widely. We also had meetings with civil society groups in order to talk through some of the proposals. So there was a consultation. Of course, with regard to the means test, that was consulted within government. We did not, at the time that we published the regulations, we did not put that figure in the regulations. We were still doing the iterations of how to reach the number of people given the allocation that we have and how to so that analysis was still being done, but within government, when we finalized the level at which we set it, we did consult inside government just to be able to stay within the budget. However, as I have already said, we will be reviewing this on an ongoing basis, depending on what sort of numbers of applications and approvals we are getting with these current iterations. Thank you.
Thank you very much. Thanks to all the colleagues who have answered the questions. In terms of the health facilities, we are indeed very fortunate in the sense that most of the facilities, as I've mentioned, there was either flooded administrative blocks where it's actual operational health facilities, it would be leaking roofs, which could be cleaned and some temporary measures be put in place and the operations remain running. There was only one facility which I believe up to now will not be operational. We just need to follow up in the north of Durban, in the Inanda area, an area called Newtown. It's quite a sizable community health center which 24-hour services. That was completely flooded, so there was quite more extensive work. Even some of the mobile structures which were in the area had been pushed by the water down, still within the fence, but some of them were consulting rooms, others more administrative. So our team and the province were still looking at how soon that facility, that one had to be closed. It had to be closed because the whole area was just mud on the floor, but when we, on the face of it, with a non-professional inspection, we are of the view that there could be a choice in terms of that once it's dry and there could be a possibility of just deep cleaning, scraping all the mud which was in the area. The other perimeter walls which have been collapsed and some of the mobile structures, those could be retrieved and placed in good position again. There was just a question, for instance, that it being an old structure, in the olden days, we have a number of structures which are still having asbestos roofing. So part of the question was whether with this disaster happening, shouldn't at the same time, because we know asbestos is not very safe, whether the roof at the same time could be replaced. But we left it to the technical teams to evaluate. But that one, as we speak, all the services have been given to the local smaller clinics. But as far as the major hospitals, all of them, where there is no water, is the temporary supply. They're not functioning at optimum because, amongst others, for instance, you will not be able to do sterilization of instruments. So your theater services will be compromised because you need real running water for the steam, to work, so that you can be able to sterilize instruments. Even some of, for instance, the Prince Msheni area also has a facility which only doesn't deal with the laundry for the hospital, but also some satellite clinics depend on that. So things like laundry, you have to find alternative ways. But fortunately, you would find, that's why we said even in the affected areas in totality, we would say at least at about 90% capacity, because there's just certain services which are not able to operate, except for this just one big community health center, which was not able to function at all. The shelters, how long? That's a difficult one. We all said that it shouldn't really, it's very unhealthy. It's got its own risks when you have many people.
All right, we end on point by coming out of that briefing, the briefing by the Social Protection, Community and Human Development Cluster that has been led by Health Minister Dr. Joe Phaahla, giving on the matters related to the national state of disaster on floods. Some of the things that have come out of the KZN floods, 16,000 people have so far been assisted. More staff have been deployed with regards to those women and girl children who are in the shelters, particularly against GBV. Families are being assisted with regards to family arrangement, and I know that our viewers are also wanting to find out about the SASSA issue. 7 million SDR applications have so far been received, and there's been a plea that those that do not need the 350 should please not apply so as to make space, particularly for those that need it. And in education, over 370,000 has so far been spent on purchasing school uniforms. This is for children who lost their belongings, and so far 630 schools have been damaged in the province of KwaZulu-Natal.